my name is Allison Sharon, and I'm a dental hygiene student at Vermont Technical College, and I'm in my second year. Today in my presentation, I'm going to be talking about the handheld dental x-ray machine. First, I'm just going to go over the agenda of my presentation. So I'm going to talk about the current dental x-ray machine and some ramifications, which include dental office expenses, time it takes to expose radiographs, and safety of the patient. And then I'm going to talk about my solution, which is the Nomad handheld dental x-ray machine. And then I'm going to talk about the project budget and conclusion, and ask if anybody has any questions at all, which I will answer. So the first ramification of the current dental x-ray machine is that digital x-ray machines are very expensive, and their cost ranges from about $11,000 to $15,000, and this doesn't include other expenses, which include the computer and software, installation, maintenance. And I found a quote from a dentist, and he said, "The armamentaria are expensive, fast evolving, and relatively new, so there is a risk of the technology becoming obsolete quickly, or the manufacturers failing to survive." And my second ramification to the current dental x-ray machine is the time that it takes to expose radiographs. Exposing a complete series of radiographs using a digital x-ray machine on patients usually takes about a half hour to an hour, which is quite a while. And a quote from a dentist, Larry Emmett, he said, "You carefully place a film, ask the patient to bite, the patient winces and wiggles, you position the cone, reposition when it starts to drift, run from the room, push the button, wait for the beep, run back, take the film when the patient hands it to you and the cone seems to have drifted again, but you can't be sure." Yeah, so it takes quite a while when you have to put the image receptor into the patient's mouth, and then you have to walk out and expose the button each time you take an image, so that makes it take longer. And my last ramification to the current dental x-ray machine is the safety of patients. So the amount of radiation that the patient receives today is quite low with dental radiographs. However, the most common error that occurs from taking the radiographs is retakes due to operator error. So this results in the patient receiving more radiation exposure, which should be avoided. And according to Evelyn Thompson, who is a registered dental hygienist, is reducing patient exposure to radiation is an important benefit to digital radiography, but is quickly negated when careless techniques lead to abundance of retakes. In medicine, some reports show that digital radiography has an increased rate of retakes than film-based radiography. And now I'm going to talk about my solution to these problems. So my solution is the Nomad handheld dental x-ray machine. And this x-ray machine will save money. It's a lot less expensive, and dental offices will save thousands of dollars. It also saves more time, since the x-ray machine can be brought right to the patient, and the dental professional does not have to walk in and out of the room to expose the images. And last, it's low radiation exposure, and you can avoid retakes. Evidence has shown that the Nomad is equal or less to the amount of radiation exposure of current dental x-ray machines, and it's found to be more accurate, which avoids retakes. And on my next slide, I have some pictures. So on the left is a picture of a woman with a lead apron on, and these are all other materials that are included, or that are included to buying digital or the handheld x-ray machine. So on the left is a picture of a woman with a lead apron, and the lead apron is very important because it protects the patient from most of the radiation exposure. And on the top, the image on the top is pictures of XCPs, and these are devices that hold the image receptor in the patient's mouth to take the image. And the picture on the bottom of the slide is pictures of phosphor plates, and these are the image receptors that are placed on the XCP and placed in the patient's mouth. And then these are scanned to produce the visible image on the computer. And then the other picture on the far right is just a picture of the image receptor and the XCP being placed into the patient's mouth. And on the next slide is a picture on the left is a picture of image scanner. So that is where the phosphor plates are placed, and then they're scanned onto the computer, which is the other image, and then you can view the images. So now I'm going to talk about the budget. So the Nomad handheld dental x-ray machines cost is about $20,000, and that's for about four of the handheld dental x-ray machines. And then the computer and scanner cost is about $5,000, and other supplies are lead aprons, phosphor plates, and XCPs, which is about $1,500. And then the project director for half a year would be $25,000, and the total would end up being $51,500 about. So in conclusion, the Nomad handheld dental x-ray machine is less expensive, there's better time management, and it's very safe for patients. Alright, does anybody have any questions at all? Alright, thank you.